Currently breaking news Abeka say patches Oko China Memoir. It's like we are reliving what happened in 2019 and they say KCB asanso akupimu ewo China Memoir. We are learning that this is also a virus and I say so to say a coronavirus. Democrat said this is even more deadly and more treacherous than coronavirus. Yes, something. Now we should screen so let's just put this on the screen. We are causing unnecessary fear and panic. This is coming from UK's independent newspaper. Or say hMPV virus latest. Doctors say it is vital China shares infection data as India ramps up monitoring. So this is exactly what is really happening. You recall that this was exactly how the COVID-19 started.
Yeah.
Okay. COVID-19 see and started here. You see Arabia and started with China. After the China also nothing. And they say I spread it all over the world. Is it that what is really happening based on what they will so far? Should Ghanaians be alarmed? Should we ban flights to China? What is really going on? Because this is exactly how coronavirus started.
Okay, so my memoir for once again. Saturday na yenua bema nana ekano. Currently no ukopiem most of the hospitals are China there. Utimu say nipa pina na abodompim. Nititire ne mofra this time around no mofra na do so pa ayetwemu say yade anase virus bia more like no so I want to say COVID-19 say na ekano through fluid ne ade ase cold ne ade. But Omakate edin short say hMPV. But the actual name no human metapneumovirus. International say titire no enkra ena airtie yarewe affect your mopa China ama say in China hospitals no I very crowded. I almost try say omo ebe solve yarewe. Now we've done one or two research from BBC near the and the information we are gathering no HMU say yare no enye yare foforo virus we enye virus foforo omuchemu say since 2001 and virus we spark up normally no affect enkra afei na omokodi omo fifth birthday and I say omo fifth anniversary yes inti no enkra pa na dey etaichi omo inti Netherlands and a virus we appear you honum first in 2001 and they started to spread. Usually, the symptoms of this virus no air cough, fever, and a nasal congestion. That's like flu near a day. Intuition the symptoms of this virus now. And I'm for you say I say COVID-19 AI peka crap. And they are saying said the mode of transmission no when you get into contact with obia when you be and now so say bia o de won sa koso surface bia obi ebia nipa na hwente anase wabo wa and it's more like the coronavirus yes obi a wenye bi wo kwaka nipa ne pe wenye bi anase nipa ne bo wa enamframem it will suit me bia na nose mask boy no finchim no. That's the exact thing.
Exactly. But let me chip in this. Social the screen so said disease experts has urged China to share information data amid outbreak of human meta virus. Which has spread virus. Which has spread across 4 countries. So now we are learning that it has even spread across 4 countries.
Yes, because
and one country is India.
Yeah.
Ako India CCA, I'm a Australian National University.
Yes.
Yes. Need data so everybody can know how to actually putting measures so BBC now that is not all. You were saying something about the symptoms. As you can see on the screen, just coming from Independence. Also, the virus that causes flu or cold-like symptoms has seen cases spiking across northern Chinese province this winter, particularly among children. So as you were saying, photos and videos of people wearing masks in hospitals in China emerged on social media platforms. And local reports compare the scenes to the initial outbreak of COVID. So this is exactly what you were saying. India has also ramped up monitoring of case hMPV after it spread to their country, as well as to Malaysia and Kazakhstan. So
yes, and one thing that a man phone so can watch them currently with this whole virus thing, no hMPV virus, no much you say winter no because currently we call China almost winter season. And no na ama adena babe west. And you remember when COVID so by you say winter. And the to Ghana the real buoyant the immune system near tight in Tenya there you be enkunye any other. So ama people are drawing the line between these two. I said there is a similarity here. It was a virus me new way mu any other. And I don't know say na now be kaya. Omoto abari ya Donald Trump ewini ye. Ena chese binumu echere say ade we Donald Trump wini they will do anything possible say omobema pape ne administration aye nyamanyama bi zenye e ba kwosisa viruses ni ade aba begu system ni mama papa na so be shepa so some are saying say I say ensema yetiti won from him say enche ye be say virus bi enenam kromu no I say no a ena asha ase nti ebe ya nka na yam starting mo ye ho ban preko ene mo bia nko bia krom na ene India fo ne China fo no mo mfanye omo ho cause the moment they start traveling around no ye ni beba ye ho na chese yare no atere na fe lockdown wasamba ni ya ebe yo obolo no yetimi ya obolo but at this point we are not praying for lockdown because baby area say kodo we are heading forward e dey any lockdown ne any amba baby sing.
Yeah, also last year, Obi Kasim, and our last 5 years, COVID-19 by Obi Kasim said, Yare no, and yes, a crowd, because virus science, virus, no, after sometimes, naturally, after sometimes, virus, no, it fades off, it loses its strength.
Okay.
But when it fades off and loses its strength, if it be mutation, about 10 times
in another
worse.
form. Yeah.
Exactly. So, we share doctors during the COVID-19 time. They give us 10 years. 10 years, say we might be having another COVID-19 in the year 2029 or 2030. Because almost a virus, no, it be a coach through a certain phase of any mutation.
Okay.
So, yeah, can you say, you know, what measures are we putting in place, not just here in Ghana, but also in Africa?
Okay.
Because COVID-19, it disrupted business, everything. So the way forward,
you workers off near there.
Exactly. And even one thing is, Asa said China, they are not giving a clear glimpse of what the virus is. No, we might be thinking, say, a young bofra, ebebane in penny for any year. You remember that was the same thing that they gave initially the COVID-19 ban. There were scores of economists who were but Frankwa any Nkofo Minyini
aged.
Yes, and a HCA who say in Branty Critimi so and we saw that it killed a lot of our people. Say John Money at the Adin. Yeah. So as I was saying, just this particular quick break though, these kind of things though, happy that I just say we need to take as a proactive measures and preemptive steps a bit. So the question is, Aban is saying, what is Ghana doing? I know it's any day a year President-elect John Dramani Mahama is here, so but we should be thinking a step ahead and further. So what is coming in terms of a government tackling this issue and also the Ministry of Health?
Well, I think that's
and also one thing I would like to ask is there any directive on the ban of flights from China to and fro, and are we going to check one more China airbar? Because if you don't start early, no, almost started. Most they be a young from China, mobile na ABR, and yes, ABR we are being stereotyped, but they can't be bringing. So should we? Is this screening or anything? What is really going on?
Well, currently, no, any information say ban flights from China to other countries. Like you were saying, you know, they are trying to hide certain details about this whole COVID thing. This whole hMPV thing. Because if you are telling us that a unity 2001 Netherlands, meaning say about munim said them solving what I say. So they are trying to hide much details about it. Say the bear and affect amount for business because once other countries and other states get to know the intensiveness of this whole virus thing, borders will start getting closed near their flights near there. And so currently flights have been halted from moving from China to other states. Na yeba Ghana hanum so a Ghana crowd them so monte so dogo bi no abe. Yes, the omo the any man say ye koswe ye president in and when they say ye main focus and ye we and you know I don't know say bia say no and Ministry of Health. And I saw them I mean can say Ghana Health Service because currently Ministry of Health no obi anda no. Into Ghana Health Service for best start so more taking into consideration there. But yeah, Ghana had they say the any abre wo na cholera because cholera tete krum her. But with the hMPV ne there Ghanaians have not started taking any decision or any action, especially from the health sector no towards it. But we hope say ombemo maso akọ kakra say the be ya engine semo ansa na ye ni abaye ho so. Na mbefa ye numu. So that is what is happening currently with this whole human meta pneumo virus. We say yeah.
Okay, so as you are saying now, no, the best thing that we can do is just to